Hi, my name is Aarti Sridhar, and I am a thoracic medical oncologist at UT Southwestern. I'm excited to talk to you today about HER2 mutated lung cancer. It's an exciting space with a lot of new drugs and approvals down the pipeline, and really great for our patients. So let's get into it. Today, I'll talk about what HER2 mutations are. How do we test for them? How do we treat HER2 mutated cancers? And really, what's in the pipeline? What are we looking forward to? What are HER2 mutations? HER2, which is also known as ERBB2, um, these are mutations that belong to the EGFR family. And so these are tyrosine kinase receptors that are associated with mutations that can cause lung cancer. Mutations in HER2 can happen in 2 to 4% of patients with metastatic non-small cell lung cancer. The typical patient is someone who's never smoked, and unfortunately, about one-third of the patients has disease that spread to the brain at the time of diagnosis. What are the different types of EGFR mutations? There are a couple of different types, and not all of them have therapies for them. So the first is gene mutations. So if you think of your DNA as a sentence or a script, gene mutations are typos in the script or a word or a sentence that's added or deleted by mistake. Then we have protein overexpressions. Protein overexpressions are when HER2, for example, is overexpressed on the membrane or the covering of the tumor cells or any cells. Amplifications are related to extra copies of the gene, and this is a little less relevant in this discussion because the treatments that we have approved are mostly for gene mutations and protein overexpressions. Let's talk a little bit about gene mutations. Like we discussed previously, these are really 2 to 4% of non-small cell lung cancer. And these are called driver mutations. And they're called driver mutations because they're known to drive the growth of the cancer. Oftentimes, when you have a driver mutation, such as HER2, you will not have other driver mutations that drive the growth of the cancer. So this will be your primary mutation or the primary mutation in your tumor. This is a common therapeutic target. So a lot of the drugs, most of the drugs that we have in the pipeline and the drugs that are approved are for patients whose tumors have HER2 mutations. The way we test for these mutations is next generation sequencing. There are other ways to test for these mutations. Your provider may test for them in different ways. However, the most common is next generation sequencing. Now we will talk about HER2 protein overexpression. So this can happen in anywhere from 2 to 20% of patients with non-small cell lung cancer. And the way you test for protein overexpression is by a test called immunohistochemistry. We will say IHC. What we do in immunohistochemical testing is we stain the slides, which have the tumor specimens in them, to see whether the covering or the membrane of the cell stained positive for HER2. Once the sides are stained, the pathologist who's assigned to your case will then grade the staining 0, 1, 2, or 3. And anything that is 3 plus is considered positive. Right now, the therapies that we have, or one of the drugs that we have, which we'll get into, is approved for patients with HER2 3 plus positive overexpression by immunohistochemistry.